What is dementia? I'm doing a video to help people who have dementia or to help people who are looking after somebody who has dementia. Dementia is a chronic mental illness which is not uncommon in somebody who is beyond 65 years of age. Having said this thing, a large number of people beyond 30 to 35 years of age also get affected all over the world. Now, all of us do suffer from forgetfulness. Perhaps being forgetful once in a while is part of normal life. We all do things like making lists or putting reminders on our mobile phones and such like to help us remind about our things which we might forget. However, when this forgetfulness becomes much more acute, then we may have some serious problems linked with this forgetfulness. Yes, it's right to say that most of us will become more forgetful with age, but when these problems become so much that they interfere with the normal functioning of the normal life of a person, then this may be the first signs of dementia. I must say one thing over here, that though forgetfulness and memory problems are often the first signs of dementia, this is not always the case. People with different types of dementia may present differently to the doctor with the first symptoms of dementia. Okay, let's now go and start looking as to what are the common problems somebody who has dementia may suffer from. It's important to note that neither all of these following problems will always occur in all people, and neither it is true that all of these will start suddenly initially with the illness. Dementia is a chronic illness which often goes on for many years. The symptoms may gradually develop over the years, and initially only a few things may be there, but gradually more symptoms may start to come up. But even in later stages, it is not necessary that all the symptoms I'm going to tell you next few minutes will surely be there. Every person is different, and every person, the way dementia presents is different. But the following are the common problems which one may see in dementia. The first thing, as mentioned before, are difficulties in memory, which often are the starting point with the common type of dementia called as Alzheimer's dementia. Hence, somebody with dementia may forget names. Now, you and I without dementia may also be forgetting names, but when somebody forgets names much more often, and of people they have only recently met, that may be more significant than what's happening to us. Similarly, we also misplace things, like I misplaced some object recently in my house. It's so common thing. However, when somebody is misplacing things on a daily basis, so much so that they end up feeling frustrated as to every time they misplace something, that may be something relevant to dementia. Similarly, they may forget recent conversations. The husband or the wife suffering from dementia may not be able to recall a conversation which they had with their spouse or with their children only last night. Also, keeping to appointments becomes difficult. They may find difficult to learn new information. For example, if they buy a new television set, or if they buy a new phone or mobile phone, they may find difficult to operate this new gadget because they just can't learn new ways on the new information which they have to process in their brain. In later stages of dementia, some people with dementia may become disorientated, which means They may not know what time of the day it is or if it is day or night. This often occurs in the later stages of severe dementia. And when that happens, then people may sometimes wander outside and at inappropriate times, for example at night. So somebody with severe dementia may wander outside at night thinking it's actually the day. This is the first group of symptoms, hence, about the memory. The second group of symptoms is in doing things. Now, you and I also sometimes do mistakes when we cook or perhaps change our clothes. We may unbutton or button inappropriately and then realize we've done a mistake. But simple things like changing clothes or shaving or shower or bath may become much more troublesome for somebody with dementia because they are unable to process and reason out how to do things as quickly as you and I can do. Hence, they may be much slower in doing things and also may not be able to do things. One thing about driving, many times patients are pretty unhappy when the doctor tells them that they may have dementia and hence they should not drive. However, I must emphasize the fact that driving can be quite risky with somebody who has dementia, as they first of all may forget the way where they are going, and number two, they may not be able to reason out how to use the steering wheel or the gear lever appropriately. These things come naturally to us. And I can understand if somebody who has driven a car for 40-50 years of their lifetime may not feel very happy when the doctor tells them, oh sorry, you have dementia, you should not drive. But though this skill, the driving skill, has been practiced on and on, many years by anybody, this skill can get lost or at least difficulties in executing the skill if you have dementia. Hence, one shouldn't drive if somebody has dementia. As I said before, people who have dementia may be able to do things, but they're much slower in doing things. Also, you may notice their walk may become more unstable and they may appear more prone to falls. The third group of symptoms is in communication. People with dementia may find it difficult to understand somebody's speech. I'm not talking of hearing problems, which also are common in older age groups. I'm talking even though they can hear you, they may not be able to understand what you just have said. Their speech may appear not so clear and they may find it difficult to express themselves. A common symptom is they may not be able to find the right word for a particular object, and hence they feel a little frustrated and at being unable to tell their needs to somebody who's looking after them. Also, their reading may become much more slower and they may be writing much more infrequently. The next group of symptoms are recognition of objects or faces. So in later stages of dementia, somebody may not be able to recognize his or her spouse's face. They may feel for moments in time that somebody else is there in their house, and they may even become quite angry with their spouse, thinking there's an impostor in the house. Rarely, some people may also have what is called difficulty in recognizing their own face, the mirror sign. So they may, first thing in the morning, they go and see the mirror and they see a face and they just can't recognize it's their own face, and they may feel there's an impostor in the house. This is not so common a sign, and if at all, occurs only rarely in later stages of dementia. Next group of symptoms are in planning and reasoning. So people who have dementia may find it difficult to do things like shopping or planning for a holiday, managing finances. Somebody who has been a great organizer of things, has been filing things in the relevant boxes properly, You may note they just can't do this like before because they just can't think and reason out like before. They may find it difficult to make decisions. You may depend on others for helping them out. The next row symptoms are anxiety and mood, which are also not uncommon. Somebody with dementia may become a little bit more irritable, as one, they find it difficult to express themselves, but also their mood may become a little unstable. Often people may have what is called personality change, especially when they have what is called as vascular dementia. So somebody who has been quite shy and has been quite a reserved person will become much more talkative and impulsive and at times inappropriate in their behavior. Some people may become anxious or even depressed. Linked with the same is odd thoughts. Some people may become paranoid, thinking that somebody else has been in their house or is after them. A common example being they may misplace things because of forgetfulness, and then they may blame somebody else who they think has stolen their things. They may also hear or see things which nobody else can, called as hallucinations. Just to summarize, for sake of simplicity, I have grouped symptoms into these 6 types as I mentioned in the recent last minutes. 1. Difficulties in memory. Number 2. Difficulties in doing things. Number 3. Difficulties in speech and language. Number 4. Recognition of objects or faces. Then there is thinking and reasoning. And lastly, anxiety, depression, odd thoughts, agitation, irritability, and such like. Once again, I must repeat myself that it is not common to see all these symptoms in all people with dementia, and often people start with only first few things, like for example memory or difficulties in doing things or in thinking and reasoning, and only later on they may develop the full spectrum of the illness. Dementia, however, is a progressive illness, which means it can be there in somebody for many years and gradually and progressively increase over the years. I want to stop now for this part of dementia. In the second series of this particular video, I'll be discussing as the types of dementia, the symptoms of various types of dementia, and if there are any treatments available and how effective the treatments are. Also, we'll be discussing as to what things one may do to help decrease the rate of decline in dementia. Thank you.